Hey there, good morning. Dr. Barry Reed, Mason Spine and Injury Center here in the greater Cincinnati area. I want to take just a moment, and thanks for joining me. I want to take a moment to talk about specificity, being specific with pain in the back. There are many different causes of pain in the back, and we have patients come in this office all the time that say, "Doc, I went to my primary care physician. They said it's muscle, and they gave me some muscle relaxers, and it helped for a couple of days, but now it's, no pun intended, now it's back again. Can you please help me?" Well, of course. We need to find out what is the cause. There may be a muscular component. The muscles may be tight, but we need to determine if it's the muscles that are causing the pain or if something else may be causing the muscles to be tight, and we maybe in the past had misidentified the true baseline cause of what's going on. So that's what we do. We're very specific with finding out what is the number one cause. And there are different things that the body does naturally that sometimes are not very friendly to us. For instance, this is a model, and I'm not going to go too deep in the weeds with this, but all of these are bones in our low back. So this is S1, L5, L4, and this is called a facet joint. If this facet joint between L4 and L5, this guy right here, this joint, which has a little bit of movement in it naturally, if that joint does not want to move, it's restricted, or let's say it's stuck, and it has less movement than it's supposed to have, whether you're 12 years old or 62 years old. If this joint right here does not move like it's supposed to, what do you think is going to happen when you try to bend over and pick something up? It's going to hurt. And when it hurts, we're trying to move this joint and it doesn't want to move. So what this part does, your mind, brain, it sends signals down into this area. It sends signals down here to help prevent damage to this L4, L5 facet joint. And it will say, "Hey, muscles, you guys need to be tighter to help protect and prevent any further damage to that joint." So this will tighten up. The muscles all through here may be tighter than they're supposed to be. And that may be the case with lots of these types of scenarios. "Oh, my back is killing me. My muscles are just too tight." Well, yes, your muscles are tight, but the number one cause can be, not every time, but can be because the facet joint is restricted. You can take all the muscle relaxers you want and all of the pain meds that you want. But until that is loosened in this type of scenario, then those muscles are going to be tight all over again. So we see this all the time. What do? We do some easy adjustments. We find the problem. We determine specifically, is it this one? Is it this joint? Is it this joint? Because if we adjust this one and the problem exists here, then we're not going to do you any good. So we do a consultation, we do an evaluation, an examination to see if it's moving like it's supposed to. And if it's not, then we determine exactly which one it is. Is it on this side? Is it on this side? Is it down here? Is it over here? Is it up here? Is it in the SI joint? Is it the hip? Is it muscle? Is it nerve? Is it disc? Is it a combination of all of them? And if it is, we find out. We explain to you what it is. We go over a game plan, a treatment plan. And at least in this office, we give lots of gradual in increments. We give lots of at-home exercises, therapeutic-based exercises to help loosen this up, reset how tight the muscles are, whether it's here or here or here. And then patients have the ability to help speed up the process at home. So, low back pain is no joke. finding what is causing the low back pain sometimes is difficult also. Free consultations in this office every day. Free means free. The free consultation means someone who has a question, has a scenario, fills out some paperwork. I speak with you one-on-one. Ms. Jones, how long have you had this? What makes it better? What makes it worse? Have you been treated for this in the past? Can you identify anything that caused this to happen, even way back years ago? Those types of things will help me narrow down what we need to look for. And once we look for it and we can find it, then we review it, put a game plan together if we can help you. And if we can't, then we'll find you someone who can. So, give us a call. Telephone number's listed. Mason Spine and Injury Center, Dr. Barry Reed. Again, thanks for taking the time.